Loratadine, the antihistamine in Claritin-D 12-hour, provides relief of seasonal allergy symptoms such as watery and itching eyes, runny nose, and sneezing. Pseudoephedrine, the decongestant, helps relieve a stuffy nose, promotes sinus draining, and improves breathing. It is important to note that this medication is not recommended for use in children under 12 years of age due to the high amount of pseudoephedrine. The recommended dosage for adults and children 12 years and older is 1 tablet every 12 hours. It is best to take Claritin-D 12-hour in the morning to help manage symptoms throughout the day. First, let's talk about how to take Claritin-D 12-hour. You should take this medication by mouth as directed by your doctor, usually twice daily, every 12 hours, with a full glass of water. It's important to swallow the tablets whole and not crush or chew them, as this can release all of the drug at once and increase the risk of side effects. Also, do not increase your dose or take this medication more often than directed. It's important to note that you should not take Claritin-D 12-hour for several days before allergy testing, as test results can be affected. If you have any questions or concerns about this, be sure to consult your doctor or pharmacist for more information. Some common side effects of Claritin-D 12-hour may include dry mouth, mild stomach upset, trouble sleeping, dizziness, headache, nervousness, loss of appetite, or thirst. If any of these effects persist or worsen, contact your doctor or pharmacist. If your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as fast or irregular heartbeat, uncontrolled shaking or tremor, mental/mood changes, such as confusion, or difficulty urinating. Seek medical help right away if you have any very serious side effects, including seizures. While a serious allergic reaction to this drug is rare, seek medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. In the US, call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may also report side effects to Health Canada at 1-866-234-2345. Before taking Claritin-D 12-hour, make sure to inform your doctor or pharmacist about any allergies you may have, as well as any history of serious side effects from similar medications. It's also important to discuss your medical history, including kidney disease, liver disease, high blood pressure, diabetes, heart problems, thyroid problems, and glaucoma. This medication may cause dizziness, so it's important to avoid alcohol or marijuana while taking it. It's also advised to be cautious when driving or using machinery. Older adults may be more sensitive to the side effects, which can increase the risk of falling. If you're pregnant, it's important to discuss the risks and benefits with your doctor before using this medication. Additionally, if you're breastfeeding, consult your doctor before taking Claritin-D 12-hour. Remember to always follow your doctor's recommendations for the best time to take this medication and the proper daily dosage. It's important to be aware of potential drug interactions when taking Claritin-D 12-hour. Always keep a list of all the products you use and share it with your doctor and pharmacist. Avoid taking MAO inhibitors while using this medication, and be sure to check the labels on all your medicines, as they may contain similar ingredients. Additionally, do not use medications containing Loratadine while using Loratadine. It's also important to note that this medication may interfere with certain lab tests, so make sure your lab personnel and doctors are aware of your use of this drug. If you or someone else has taken too much Claritin-D 12-hour and are experiencing severe symptoms like passing out or difficulty breathing, it's important to seek emergency medical help by calling 911 or a poison control center right away. In the US, you can reach the local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of an overdose may include irregular or unusually slow or fast heartbeat, unusual nervousness or excitement, and seizures. It's crucial to seek medical attention immediately if you suspect an overdose. This medication is used to temporarily relieve symptoms caused by the common cold, flu, or allergies. These symptoms include a stuffy or runny nose, sneezing, itching, watery eyes, and sinus pain. This product contains an antihistamine and a decongestant. The antihistamine helps relieve symptoms such as watery eyes, while the decongestant helps relieve symptoms such as a stuffy nose. This medication is usually taken once every 12 hours. If you are self-treating, follow all directions on the product package. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor or the product package, usually every 12 hours with a full glass of water. Do not crush or chew this medication. Swallow the tablets whole. Do not use this medication to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. If you forget to take a dose of Claritin-D 12-hour, take it as soon as you remember. If it is close to the time for your next dose, then just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. Remember to take Claritin-D 12-hour at the same time each day for the best results. It's important to store Claritin-D 12-hour at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. For guidance on how to do this, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.